feet can often reveal early warning signs of diabetes long before more obvious or serious symptoms begin to appear. Yet most people rarely pay attention to these subtle changes. Many individuals assume that issues like dry skin, slight numbness, or occasional tingling are harmless, or simply the result of fatigue, aging, or weather conditions. What they don't realize is that these small signs may actually be the body's first signals that blood sugar levels are rising and starting to affect the nerves and blood vessels. Since the feet are located from the heart, they are usually among the first areas where reduced circulation and nerve sensitivity begin to show up, making them an important indicator of underlying health problems. When blood sugar levels remain high over time, it can damage tiny blood vessels that supply oxygen and nutrients to the nerves, especially in the feet. This damage doesn't happen overnight, which is why the warning signs are often mild and easy to ignore in the beginning. A person might notice a slight tingling sensation, like pins and needles, or feel as if their feet are falling asleep more often than usual. Others may experience unusual dryness in the skin that doesn't improve with regular moisturizing, or they might notice that their feet feel different in temperature compared to the rest of their body. These early signals may not cause pain or discomfort right away, which is exactly why they can go unnoticed for so long. As time goes on, these small symptoms can gradually become more noticeable and more frequent. The tingling may turn into numbness, making it harder to feel the ground while walking or detect small injuries like cuts or blisters. This loss of sensation can be dangerous because it increases the risk of unnoticed wounds that can worsen over time. At the same time, poor blood circulation can slow down the body's natural healing process, meaning that even minor injuries take longer to recover. This combination of nerve damage and reduced healing ability creates a situation where simple foot problems can develop into more serious complications if not addressed early. What makes this even more concerning is that many people do not associate these foot-related issues with diabetes at all. May treat each symptom separately, using creams for dryness or ignoring tingling as a temporary issue, without realizing that all these signs could be connected to a larger problem within the body. By the time more obvious symptoms of diabetes appear, such as extreme thirst, frequent urination, or fatigue, the condition may have already progressed further than it should have. This is why understanding and recognizing these early foot warning signs is so important. It provides an opportunity to take action sooner rather than later and potentially prevent more serious health issues from developing over time. Numbness, tingling, or burning sensations in the feet are often among the earliest and most noticeable signs that something may be wrong or frequently misunderstood or ignored. Many people describe these sensations as a pins and needles feeling, like when your foot falls asleep, or a mild buzzing that comes and goes. At first, it may only happen occasionally, perhaps after sitting for a long time or at the end of a tiring day, so it doesn't seem serious enough to worry about. Over time, however, these sensations can become more frequent, more intense, and more persistent, signaling that the nerves in the feet are being affected in a deeper way. Blood sugar levels remain high for extended periods. It begins to damage the delicate network of nerves throughout the body, especially in areas like the feet where circulation is already more limited. This condition, often referred to as nerve damage, develops gradually and can quietly progress without causing immediate alarm. The nerves are responsible for sending signals between the brain and different parts of the body, allowing you to feel touch, temperature, and pain. When these nerves are damaged, the signals become distorted or weakened, leading to unusual sensations like tingling or burning, or in some cases, a complete loss of feeling. One of the most concerning aspects of this is that numbness can reduce your ability to notice injuries. A small cut, blister, or irritation from tight shoes might go completely unnoticed because the nerves are no longer sending clear signals to the brain. Without proper awareness, these minor issues can worsen over time, especially when combined with reduced blood flow that slows healing. At the same time, some people experience the opposite sensation, where instead of numbness, they feel sharp, shooting pain, or a burning sensation that can become particularly intense at night. This can disrupt sleep and affect overall quality of life, making it difficult to rest or feel comfortable. These symptoms are not just random discomforts. They are warning signs that the body is under stress from uncontrolled blood sugar levels. The longer this condition goes unmanaged, the more severe the nerve damage can become, potentially spreading beyond the feet to other areas of the body. What starts as mild tingling can evolve into constant discomfort or complete numbness, making everyday activities like walking or standing more challenging and less stable. This also increases the risk of falls or injuries, especially in older adults. Many people make the mistake of dismissing these sensations as temporary or unrelated to a larger health issue, often attributing them to fatigue, poor posture, or even aging. As a result, delay seeking medical advice or making necessary lifestyle changes that could help control blood sugar levels and prevent further damage. Recognizing these early sensations as potential warning signs is crucial because it allows for earlier intervention, better management of health, reduced risk of long-term complications that can significantly impact mobility and overall well-being. Slow healing wounds, dry cracked skin, and recurring infections are some of the most important warning signs that should never be ignored. They can indicate that the body is struggling to repair itself properly due to underlying issues with blood sugar control. Many people overlook a small cut, a blister from new shoes, or a patch of dry skin, assuming it will heal on its own within a few days. Under normal conditions, the body has an efficient healing system that quickly repairs minor damage. But when blood sugar levels remain elevated, this process becomes slower and less effective, allowing even small problems to linger much longer than they should. When the skin becomes dry and cracked, it may seem like a simple cosmetic issue caused by weather or lack of moisture, but it can actually be a sign that the body's natural hydration balance is being disrupted. High blood sugar can affect the function of sweat glands, reducing the skin's ability to stay properly moisturized. As a result, the skin on the feet may become rough, flaky, and more prone to splitting. These cracks can create tiny openings that allow bacteria and fungi to enter, increasing the risk of infection. What starts as a harmless dry patch can quickly turn into a more serious concern if not properly managed. At the same time, slow healing wounds are a major red flag because they show that the body's ability to repair damaged tissue is compromised. Blood plays a critical role in healing by delivering oxygen, nutrients, and immune cells to the affected area. When circulation is reduced, which is common when blood vessels are affected by prolonged high sugar levels, this delivery system becomes less efficient. As a result, cuts, blisters, or sores may take weeks to heal instead of days, and in some cases, they may not heal at all without medical attention. This delay creates an environment where infections can easily develop and spread. Infections themselves are another serious concern, especially when they occur repeatedly or are difficult to treat. The body's immune system is responsible for fighting off harmful bacteria and fungi. High blood sugar can weaken this defense system, making it harder to control infections once they begin. This is why some people experience frequent issues like fungal infections between the toes, redness, swelling, or unusual discharge from wounds. These infections may seem minor at first, but can become more severe if they are not addressed promptly. The combination of dry skin, slow healing, and increased risk of infection creates a dangerous cycle where small problems can quickly escalate into larger complications. Without proper care and attention, a simple wound can develop into a deeper sore or ulcer, which is much harder to treat and may require medical intervention. Many people do not realize the seriousness of these symptoms until they become painful or interfere with daily activities, by which point the condition may have already progressed significantly. Recognizing these signs early and understanding their connection to overall health is essential for preventing more serious outcomes. Taking steps to maintain proper foot care, monitoring any changes in the skin, addressing wounds immediately can make a significant difference in reducing risks and maintaining long-term health and mobility. Poor blood circulation can have a significant impact on the health of your feet, and it often shows up through subtle changes like swelling, unusual skin color, persistent coldness, or even the gradual loss of hair on your toes. These signs may seem unrelated at first, but they are closely connected to how well blood is flowing through your body. When circulation is working properly, blood delivers oxygen and essential nutrients to tissues while also removing waste products. However, when this process becomes impaired, especially due to consistently high blood sugar levels, feet are often among the first areas to show visible changes because they are the farthest from the heart. Swelling in the feet and ankles is one of the more noticeable signs of circulation problems. It may start as mild puffiness that appears after standing or sitting for long periods, but if it becomes frequent or does not go away with rest, it could indicate that fluid is building up due to poor blood flow. When circulation is compromised, blood and other fluids can struggle to move efficiently through the lower extremities, causing them to accumulate in the tissues. This can make the feet feel heavy, tight, or uncomfortable. And over time, it may interfere with normal movement or the ability to wear shoes comfortably. Changes in skin color are another important signal that should not be overlooked. Healthy circulation gives the skin a consistent and natural tone, but when blood flow is reduced, the skin may appear pale, bluish, or even slightly reddish in certain areas. These changes can vary depending on the level of oxygen being delivered to the tissues. Lack of oxygen-rich blood can cause the skin to lose its usual color, while pooling of blood in certain areas may create darker or uneven patches. These visual differences are often the body's way of indicating that something is not functioning as it should internally. Cold feet, especially when the rest of the body feels normal, can also point to circulation issues. Blood helps regulate temperature by distributing warmth throughout the body, so when less blood reaches the feet, they may feel consistently cold to the touch. This sensation can be uncomfortable and may persist even in warm environments, making it a noticeable and sometimes frustrating symptom. While some people naturally have colder feet than others, a sudden or ongoing change in temperature should be taken seriously as a potential warning sign. A subtle but telling indicator is the loss of hair on the toes or feet. Hair growth depends on a steady supply of nutrients and oxygen delivered through the bloodstream. When circulation is reduced, hair follicles may not receive enough support to maintain normal growth, leading to thinning or complete loss of hair in those areas. This change often happens gradually, which is why many people do not notice it right away or consider it significant. These signs of poor circulation are not just minor inconveniences. They reflect deeper issues that can affect overall health and the body's ability to function properly. When blood flow is limited, tissues receive less of what they need to stay healthy, and this can slow down healing, increase the risk of infections, and make the feet more vulnerable to injury. Understanding and paying attention to these changes can help identify potential problems earlier, allowing for timely action that can improve circulation and reduce the risk of more serious complications developing over time. Early detection and proper foot care play a critical role in preventing serious complications that can arise when underlying health issues are left unmanaged, especially when it comes to conditions that affect circulation and nerve function. Many people underestimate how important it is to regularly check their feet, often assuming that serious problems will always come with obvious pain or discomfort. In reality, the most dangerous complications can develop quietly, without strong warning signals, particularly when sensation in the feet begins to decrease. This is why being proactive and paying close attention to even the smallest changes can make a significant difference in long-term health outcomes. Developing a simple daily routine of examining the feet can help catch problems at an early stage before they have a chance to worsen. This includes looking for cuts, blisters, redness, swelling, or any unusual marks on the skin. Even something as minor as a small scratch or irritation from footwear should be taken seriously, as it can develop into a larger issue if not properly cared for. Keeping the feet clean and dry is equally important, as it reduces the risk of infections that can thrive in moist environments. Washing and careful drying, especially between the toes, can help maintain healthy skin and prevent bacterial or fungal growth. Moisturizing the feet can also help prevent dryness and cracking, which are common entry points for infections. However, it is important to apply moisturizer correctly and avoid areas between the toes where excess moisture can become trapped. Wearing well-fitting shoes that provide proper support and do not cause friction is another essential part of foot care. Shoes that are too tight or too loose can create pressure points or lead to blisters, both of which increase the risk of injury. Choosing comfortable, breathable footwear and inspecting the inside of shoes before wearing them can help avoid unnecessary harm. Maintaining overall health is just as important as external care. Keeping blood sugar levels within a healthy range supports proper circulation and nerve function, allowing the body to heal more effectively and reducing the likelihood of complications. Regular physical activity, a balanced diet, consistent medical checkups all contribute to better management and early detection of potential problems. When the body is supported from within, it becomes more capable of protecting itself against damage and recovering from minor issues before they become severe. Ignoring early signs or delaying action can lead to serious consequences, including the development of ulcers, which are open sores that can become infected and difficult to treat. In severe cases, untreated infections can spread and cause significant damage to tissues, sometimes leading to the need for surgical intervention. These outcomes are often preventable with consistent care and awareness, highlighting the importance of taking even small symptoms seriously. By building simple habits and staying attentive to changes in the feet, it becomes possible to reduce risks and maintain mobility and independence over time. Small daily actions, when done consistently, can have a powerful impact on preventing complications and preserving overall well-being, allowing individuals to stay active and avoid the challenges that come with advanced health issues